All right. This is Denice from DTW, Denice Total Wellness, and I am so happy and proud to be coming to you today to have a conversation with a dear friend of mine from way, way back from, I was about 11 years old. And we're going to talk about, let's talk about caregivers because I'm a caregiver and I wanted to get this information out to as many people as possible about caregivers. So my special guest today is Jewel Adams, and she is MSN and FNP NEA-BC. So you know, Jewel, I'm going to ask you all the questions about all of these initials that is behind your name. So welcome to the panel. Could you explain?
Well, first I'd like to say thank you for inviting me to speak on DTW. I do remember that we have been friends for a very long time as grammar school friends in, Chicago. But my name is Jewel Adams, and I do have a master's degree in nursing, which is the MSN. I'm also a family nurse practitioner, and I do have a certification in leadership as Nursing Exec Advanced Board Certified. A lot of initials, but I'm still the same person, Jewel Adams.
Well, I am so honored to have you here today because so many people want to know about caregivers and how we should care for ourselves. Because like I said, I am a caregiver and I'm just trying to figure out how do I manage all of this. I'm taking care of my dad. I've been taking care of my son who has special needs for 33 years. So what have you seen as a nurse in the hospitals or just over your lifespan about caregivers and what their needs are and how they can better take care of themselves?
Okay. So first off, I would love to give you some statistics about caregivers, but I don't have any with me now, but I will share some later in the broadcast. I've been a nurse for 37 years this year, and I began in renal dialysis was my specialty. And as a nurse in that specialty, I saw a lot of patients, male and female, that required caregivers. Many of them were on dialysis or had diabetes or chronic illnesses. So, of course, that's a devastating disease. And I saw many people come in, caregivers from men taking care of their wives, wives taking care of their husbands, or parents taking care of their children, and children taking care of their aging parents. Mm-hmm. So as the pandemic came, it just exploded with more caregivers because we have a lot more people with chronic illnesses and needing assistance at home. And you bring up an interesting point because a lot of these patients need 24-hour care, and one person alone is difficult to be able to give that 24-hour care to one person.
And I'm just so blessed that my dad is still able to care for himself. I mean, as far as his personal hygiene, I'm so blessed because he's 89 years old and he's going to be 90 in May, and he's able to still take care of that. I just take care of the needs of, fixing his food. And of course, he's still old school. He wants me to bring him his plate. So he can move around. So, I'm blessed. I'm so blessed. And the same thing with my son. He's able to move around. I assist him in some things that he has to do for his personal care. But yeah, I'm so blessed.
Well, that's amazing that you're even able to do those things. But what happens if you're not? How do you decompress? These are some of the things that the caregiver needs to think about. If they're cooking and cleaning and caring for their loved ones, who's caring for you? What kind of things do you do to decompress? as a nurse, we give all the time. We're always giving, taking care of patients. So sometimes when I come home, it's like I need to replenish myself in order to be able to give more.
Exactly. So
That's
what do you do? What do you do as a nurse? Because you're doing this as a profession, you know, and I know you all work many hours. So I take my hats off to all the caregivers, all the nurses, the doctors in the hospitals, first responders. I am so thankful and blessed that you all are doing what you're doing. So what do you do when you come home? Like you said, you got to decompress. What do you do? And then I'll share you some of the things that I do.
So some of the things that I do personally is that I like to take trips. I love to travel. So when I travel, I don't think about anybody else. I go to exotic places. I enjoy myself, and I don't think about anything that's going on, you know, as far as caring for someone else. And I do that. I guess I used to do it several times a year before the pandemic hit. Since COVID, it has slowed down, but I hope to be able to do that again in the future. As far as little things, sometimes you just have to have some quiet time, you know, quiet time to meditate, to reflect. Sometimes I do it on the way home in the car. People decompress by listening to music, watching a movie. I drive a convertible, and in the summertime, even in the wintertime, I'll turn the heat on and let the top down and get on the expressway and just drive. And that is
how nice.
very exhilarating.
That is cool.
And refreshing. It just allows you to just relax and just let things go.
It sounds like it. So for me, I am you know me, I'm into the health and wellness. So for me, you know, I always say master the morning, you master your day. And so I meditate first thing in the morning. As soon as I get up after I brush my teeth and drink my water, because I am a big advocate of first thing drinking a glass of water when I get up. Yes, and I have some here as well. So I have that, then I do my meditation, then I start my day. But for me, I like to go, I went last week and I got a massage, I went to the sauna. Those are the types of things I like to do. Yes, I like to travel. I haven't traveled, like you said, since the pandemic. I haven't traveled. Well, I did do an event last year in Dallas, but I love to be by the water and the ocean, and so exotic islands is definitely what I would like to do coming this year. So yeah, so those pretty much is what I do. I like to get out in nature, walk a lot, and just you know, center myself with Most High. And so that's what I usually do, decompress.
I would love to say exercise too, but I'm not consistent. But when I exercise, it just seems to release endorphins that makes you want to continue to exercise. So that's another great relief.
Yes, it is. And that's what exercise is intended to do, to help you become more energized, to become more aware. And it is definitely, for me, a way of life now, at least doing 30 minutes a day. And I'm going to get you back out there doing something. You got to walk 30 minutes because you are a vital part of being, a caregiver, being a nurse. You have to be, your cup has to be full before you can take care of anybody else.
That's true.
So have you seen caregivers? What will make for a better caregiver? I mean, what can also caregivers, what have you seen in the hospitals about caregivers that most of them don't do?
What I have seen in the hospitals, and basically this is pre-pandemic, is that they come to the hospital with their loved one and they want to stay there 24/7. And they want to disregard their own personal needs, maybe food, rest, even medications at sometimes. they sacrifice themselves, to be there to take care of their loved one. So some of the things that we try to do as healthcare workers is to ensure that they trust that we're going to do the right thing for their loved one. Many times I have given meal vouchers to them and say, just take a few minutes, go down to the cafeteria, eat. If you don't take care of yourself, who's going to take care of your loved one if you're not here?
Exactly.
So you have to build a relationship and build trust with them. So that's one of the things I see.
Yeah, I remember when my son was admitted into the hospital, and again, I have David, he's special needs, and so he's not as verbal. Everybody can, well, he speaks, but everybody can't understand him. And so, yes, I wanted to stay, and it was during the pandemic. And they told me when I came in the hospital that once I come in, I can't go back out. I can't leave the room. And so I had to have my daughter bring me a bag with my, toothbrush, even though they were going to supply me with a toothbrush. But like you said, medication, I needed my medication because I am on high blood pressure medicine. And then, so while I was there, it was a lot of times that they couldn't understand him. And then I'm so protective, about him over these last 33 years that I'm just like, nobody can take care of my child. But like you say, I have to prepare myself for the day that comes that I'm not here. And what do I do? And not to get off subject, but I am trying to get to that point because, we all think we're going to be here forever and we're not. So,
well, unfortunately, that is everyone's outcome is not to be here eventually. Yeah. But I think that you made a very good point. A lot of hospitals have a patient and family-centered care delivery model. And we invite the patients' families to help us to care for their patients and their loved ones because they do know, you say your son's name is David. You know when he's looking for something to eat or if he wants to go to the bathroom. And sometimes those things are not easily communicated to us. So it's important that we individualize the care, that we listen to the patient and to their family so that we can better care for them. And that definitely will build trust.
Yes. And that was another thing that I was going to say as a caregiver. Since I've been taking care of and it's so funny that when you're taking care of your family members, that is so difficult when you're a parent, I'll say your parent, because I noticed my dad, I take care of his, needs here in the home, but then he has a nurse to come in and checks his A1C with diabetic and his pressure. And I get all this flack, when I tell him to do something. And then when the nurse come in, he's nice. He gives them all the right answers. He's really, responsive, answer them really nicely. But I say something, blah, 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 blah. I'm still a kid. And I keep telling him, just answer the question.
And you'd be surprised. Sometimes it's the opposite. Sometimes the healthcare workers get the flack and the family members get a better result. Oh, wow. It just depends on the relationship. So we just try to work with the family and with the patient as a partnership to improve their health. Yes.
Okay. Well, I'm going to kind of get off of being what a caregiver needs to be a better caregiver. So I'm kind of going to go to mental health, mental health for the caregiver and for patients. It's hard dealing with, again, my son has seizures and he was born with the number 2 chromosome deletion.
Okay.
So that was something that, could not be corrected. And that's probably another conversation for us to talk about how I got the news and how I dealt with it. But, caring for him over the years, my mental state. I'll admit that I had to go talk to someone about it. And we're so ashamed, as our Black community, we're ashamed to talk about going to see a psychologist or a psychiatrist to deal with situations. And there's nothing wrong with it. I think more people need to go because we all have some type of trauma, some childhood trauma or adult trauma. And it's good to have a biased opinion and somebody that is a professional. So I know you probably have experience with patients with mental illness and just dealing with caregivers that have to deal with so much mental stress. That's what I guess I should say.
So you would really be surprised at the statistics of people with mental illness. And it's definitely a comorbidity. Since the pandemic, we have seen a rise in overdose, depression, lots of mental illness. And like you mentioned, it's something that we don't mention in the Black community. As my son was growing up, my son has a mental illness, and he was 16 when I realized some things were not quite right.
Mm-hmm.
And he would make statements that were kind of bizarre.
Mm-hmm.
And because I'm a nurse, I think I recognize some things there. But it was difficult for me to come to grips with that because once he's labeled with mental illness, it kind of shuts the door on certain things. So I had to come to grips with that. Since he was diagnosed as a child, it was easy for me to direct the care and to be an advocate. But once he became 18, if you are mentally ill, you have the right to refuse treatment. You do not have to take your medications, and you don't have to have your mother involved in your care. So that was kind of interesting for me to learn as a parent of a mentally challenged child. Yeah.
Well, that's interesting because even though David is on a different spectrum, at the age of 18, I became his, well, I didn't know. It's so weird that we're talking about this. It's because when the school counselor, her and I were very good friends. And so she was like, well, before David turned 18, we got to go to court so you can be his legal guardian. I said, but I'm his mother. And so why wouldn't I be, his legal guardian? She's like, no, you have to go to court and you have to get the court to give you that. And so I was just like devastated because I'm like, I'm his mother. So we went to court. I became his legal guardian where now I can make all decisions for him. So, I don't know, because I know you were in a different state at the time. So I don't know, could you do that? Or that wasn't an option?
It depends because say, for instance, your child has depression. And you want to be involved in their care. Well, once that child turns 18, they have to sign documents saying whether or not you can even be involved in the care or discussion of the care because of HIPAA.
Right.
Once they become an adult, if they have capacity, they can manage their own care, whether they have depression, schizophrenia, bipolar, unless they have no capacity and someone takes guardianship of them, they can decide their own care. They're participants in their own care.
Wow.
And you're correct. In different states, there are different laws based on that. Say an aging parent. So if you have a parent with dementia or Alzheimer, and this comes on gradually sometimes. Some of the diseases, you have to know which one it is, dementia versus delirium. But these things come on slowly. And so the parent may lose some cognitive function or not be able to remember certain things and just not have capacity. And then at that point, you would either have to be named as their, what do you call it? It's not an advocate, healthcare proxy. And you
Oh,
would
okay.
be the person that would take care of them, not necessarily taking guardianship.
Mhm.
And you just open a whole nother can of worms because just because you have guardianship does not give you power of attorney, and it does not give you power of attorney over healthcare. There's a lot of legal implications related to patients or people not having capacity and what you as a parent or a caregiver can do.
Mhm. Now you made me. That's why I knew that this topic, we were trying to, for the audience that's watching, we were trying to narrow this down. And there's so many things that we can talk about because, again, I'm caregiving for my father, my son, and you brought up, um, the HIPAA laws, but we're going to we're going to save that for another day. But you did talk about dementia and Alzheimer's. So I want to know because a lot of people really confuse the two, and I do too, because to me, they're both the same. But I know that they're not, and I have read up on it, but they still look the same to me.
So Alzheimer is a disease. Dementia is a symptom of Alzheimer. You can have dementia from other diseases. Delirium, on the other hand, is usually temporary, and it's usually caused by an electrolyte imbalance or usually an electrolyte imbalance or some kind of infection can tip the scales, and people can become confused or delirious is what they call it.
Mhm.
Hypoxia or shortness of breath, not having enough oxygen to the brain can also cause delirium, which is like a temporary confusion. However,
Okay.
if you look at Alzheimer or I can't even think of any of the other ones right offhand, but you're looking at a gradual decline in cognitive function where they may not remember certain things. And eventually with Alzheimer, they may not remember you, who you are or what to use a spoon for. So that's a totally different situation. Either
Hmm.
way, you want to treat the symptoms because
Right.
there's no cure.
Yes. Okay, so with me being in the healthcare, the naturopathic way, um, from my perspective, and I know that once it starts, you can't reverse it. But I'm always thinking of diet. I'm thinking about how we eat and why we have so many diseases. Now, my studies have been that mucus in the body, inflammation in the body, is the foundation of most diseases.
Okay.
That's what I believe, and I know that we're gonna do. Remember, people, we're gonna do holistic versus pharmaceutical at another time. But right now, we just want to introduce ourselves and just get the conversation going about caregivers, mental health, and taking care of the elderly and special needs community. Because that's who I am. I am that person that does all of that. So, look, and I done got off track because I'm thinking about all the things that we can talk about. But, oh God, what was I saying?
That is one reason why I thought it would be good. I'm glad you recorded this because now you can go in and pick apart which areas we need to dive into.
Mhm.
Because once you open that can of worms about adult children versus children, and how do you intervene or how do you take care of somebody who does not want you to take care of them? You mentioned about your dad discussing things with the healthcare provider versus
Mhm.
talking to you about it. it may be some things that he prefer not to discuss with you. And so you may not even have all the information to care for him. And then we have other cultures that they don't want to know they have cancer. They don't want to know the treatment plan. They want their children to decide everything, and they rather not be a part of that process. So the caregiver role is so different, but it's very individualized based on who the caregiver is, and the caregiver and the patient's culture and the provider.
Now that's interesting because I never knew that in other cultures that they let the children dictate their caregiving, what should happen. That's interesting.
Yes, that's true. Certain cultures um, don't even speak English in this country. It's some of the elders, and they rely on one of the children who is appointed to get all that information and make the decisions based on that.
Oh, wow, that's interesting. Very
Yeah.
interesting. So my other question is, far as caregivers, because we have opened up so many worms cans because I'm like, I don't even know where to go now because my mind was set one way and now I'm thinking about where should we go with this? Because I was going to break it down into 4 different parts. And so today was just like, again, the introduction to caregiving. So yeah, so wow. I am going to take a pause on this. So, as being my dad and my son's caregiver, Jewel, what would you suggest that also, we talked about the things that I do, but is there any other things that I could do to help me mentally as well, as being my dad's caregiver? What am I missing as well?
Well, you want to make sure that you are able to get enough sleep, that you're eating correctly, and definitely DTW helps you to do that, with the affirmations and meditation. But it's really important for you to have a relief person. If you are a only child and you're caring for aging parents and your children at the same time, they call that the sandwich generation, where they are taking care of an adult parent and maybe an adult child with special needs, or babies. They have people who are just starting out to have children. People are having their children later in life. So in the late 30s, you may have a child under the age of 5, but you may also have an aging parent with cancer or diabetes or Alzheimer, in 50s, 60s, 70s that you're caring for as well. So it's really important that you have an alternate or somebody that can take over, just to give you a break in there.
Yeah, well, speaking of that, I am the only girl of 2 older brothers. And they're out of state. So I have been blessed. I'm not going to just run them in the ground, but I have been blessed. So when I have wanted to go on my vacations, both of them have come to help take care of my dad. And then my other brother that's staying in my dad's house, Tim, he's going to supposedly coming to get my dad in May to give me about a month's rest. But that is so true that you do need somebody to come in and help. So that's why I kind of leave the house every now and then. And when I'm really feeling overwhelmed and go for when it's warm outside, I go outside and I walk my little dog and just go to the park because that's the way that I kind of decompress and get away from everything. But I do get I do try to eat right. Like I said, I meditate and I do sleep good. I try to sleep, pretty much sleep good. And like you said, a lot of people ask me, how do I do it? And for me, it's just an everyday thing. So I don't really feel the stress, but I know that sometimes it can get overwhelming for me because I'm trying to do, health coach with other people, helping them change their lifestyle, eating habits. And so that part, because I'm doing something I love, I think I was created just to be a caregiver. And it's funny, one of my other friends growing up, Sharon, she was like, you should become a nurse. And I was like, girl, I didn't think I could deal with the blood and everything in the hospital. But now, I'm just doing something that comes natural for me as far as caregiving for other people. And so it's just natural for me to care about other people and to help them, be better versions of themselves. But that is a good point about getting some relief. And I know it's a lot of other people that probably don't get that. And I know that can be overwhelming.
So I would be criticized if I didn't kind of define about nursing. Nursing may not always be about being in the hospital and blood and things. Because I need people to know that nurses as a whole do a lot more than just care for patients in the hospital. We have nurses that are in the hospital, which is probably the bulk of nursing. And we have school nurses that teach about health and wellness in the school system, grammar school as well as high school. We have nurse practitioners. We have, and that's a whole new door that has opened up because of the physician shortage. Nurse practitioners are actually able to care for patients in the medical office setting of not complex patients, but patients, that can come and get regular screenings and health screenings. Lots of different areas for nurses to be involved. Nurses are employed by pharmaceutical companies. They are employed by device companies. They are care managers to help patients to navigate through the healthcare system. They also are even employed by insurance companies to review charts, and by the legal system to make sure that our standards are being upheld, and nursing leadership. There are so many different avenues in nursing, especially even since I've been a nurse over the past 30, 40 years, and it's still evolving.
Wow. That's good to know, because maybe I should have went off into nursing instead of banking. Because like I said, it's so natural for me to care for other people. But some of that stuff, like I said, that schooling, not for everybody. But also, caregivers. We have so much on our plate. So do you think that, we were talking about dementia and Alzheimer's. So do you think, and I was saying, now I remember, I was saying about the way we eat, and that most diseases come from inflammation and mucus in the body. Do you think, or have you heard that, or what's your stand on that?
So I am a nurse, and I do believe in medicine. I also believe in holistic medicine, and I think they can work together.
Okay.
Yes. And I do think that inflammation can cause a lot of different things, but there are other triggers that are in the environment and in genetics that play a big part in, our outcomes. I'll say that.
Okay. All right. We'll get in depth on the next episode about some of this. So with me caring for my son so many years, and I know I joined a group. So I joined these groups on Facebook, the autism awareness, and then I just joined a parent group of people with taking care of their family members. And you think you have it so bad until you listen to other people and their situations. So this one lady put in the comments the other day that why is her parent lying all the time? And so, the conversation went back and forth with a couple of other people. And so I didn't jump in as of yet because I'm just trying to see where everybody else is going. But I found that some parents lie and some of them just see it from their perspective. It's the way they see things. My dad is not as headstrong. Well, he is headstrong on certain things, but he wants things done his way. Well, we're in my house, so then we have that aspect, and I think that was the lady's dilemma because they were at her house. Her mother was at her house, and her mother wanted her to do it a certain way, and they got into it about doing it another way. So I have come across that as well. So dealing with our parents, what are some suggestions that you could give us with dealing with these struggles?
Okay, I do hear you. And I wouldn't say I wouldn't be as harsh to say it's a lie. But I have seen parents come into the hospital and have surgery, and the child is sitting there and they say, "Oh, I'm having so much pain, and I'm just not getting relief," those kinds of things. And this is somebody who just had surgery. And then when the physician comes in and they say, "Well, how are you doing, Mrs. So and so?" "Oh, I'm doing fine, doctor." you know, so I think it has to do a lot with the generation. The baby boomer, the silent generation, they don't complain. They do put up with a lot of things as far as wait times. And you have to look at that when you're looking at patient satisfaction. Whereas Generation X, they don't wait for anything. They want everything done yesterday. And, that group is moving up into the elderly group now. They're in their like 40s, approaching 50. And that group is totally different on how they approach and see things. And based on how you answer questions, makes a big difference on how people treat you. And culture and diversity plays a big role in it too. So like you said, it is about their perception. Yeah. And your father may say you may view him differently if he tells you certain things. Yeah.
Yes, I do. Because he still looks at me as the little 6-year-old, and I'm like 61 years old. And I'm like, can you talk to me a little bit better?
So we have to open the communication up though. Seriously, we have to look at signs and symptoms of things. Let me give you an example. Some of the blood pressure medicines can mess with your libido. And so sometimes men may be reluctant to share that information. They may just decide not to take that medication. And if they don't take the medication, the high blood pressure can cause organ damage. So they end up with renal failure. A lot of different things can happen with hypertension. And it's called the silent killer. So if they don't take the blood pressure medicine and they don't feel like, they're being affected, before you know it, they can be on dialysis. And if they had just spoken to their healthcare provider or been honest with their spouse saying, this medication is messing with my ability to perform sexually, then we can avoid those things by changing the medication, adjusting the dosage, in order to work better together. So it's really important to trust and share information with your healthcare provider.
Yeah, I agree too, because I know somebody that was like that, was on blood pressure medicine and they didn't want to take it because of the libido. And I'm thinking you would rather sacrifice your life because your sex life has, kind of depleted. That's to me, men that's listening, that's crazy. That's really crazy that your health, you don't find your health more important. But that's the reality of it. And, I had an issue last year with my high blood pressure, and I'm on medication and I'm holistic. And so it was a struggle to have to take pharmaceutical drugs, but that conversation, yeah, is supposed to stay over there. But I understand. I put my health first, so that's what I try to, think about first. And then I have my family, I have my kids, my grandkids.
You have to think about, you have to think about the quality of life too,
Yes.
because some people may feel like, what good is the quality of life if I'm not able to experience certain things? So, like the person with oncology, if they're doing the chemotherapy and they're so debilitating sick that they can't live life, so they have to make a decision based on their own personal experience. And sometimes it's not what we think we would do. And it's not a matter of health versus not health. It's a matter of quality of life.
And that brings you just took me back 24 years when my mom was diagnosed with colon cancer. And toward the end, hopefully I can get it together. At the end, it was about the quality of life for her. She chose to not, it got to the point where the cancer got to the liver, and once it gets to the liver, it's pretty much just a waiting game. And so, yeah, that just brought back a whole nother thing. And so she went through chemo, and now that I know what I know about chemo, in retrospect, if we was to go back, I don't think she would have did it, because this is what they told us. And, I don't know if they tell this to everybody, because every doctors I know operate different. When she was getting ready to take the chemo, they said that, it can either multiply the cells or to kill the cells, the good cells and the bad cells. And so the way 6 months after the surgery and the chemo and everything, they said it spread it. So that was like, to me, it multiplied the cells because it spread it. I don't know if that means that it helped, the chemo helped, spread it. I don't know, but when they told her, I think that she would have preferred not to have it, but in hindsight, it's that's a touchy situation.
Yes. And you also have to think about, I don't know why I'm thinking that, but you also have to think about how holistic medicine interacts with the Western medicine. If you're taking a medication that prolongs bleeding and you're already on anticoagulants, those things can enhance or potentiate each other. And you have to let your provider know if you're taking other remedies besides the medications that they're offering you, because they can also have an effect on, the outcome.
Right, because some of the products that I have that I use, and I found out one of them is similar to a blood thinner, and my dad is on blood thinner, so I knew that I could not give him that medication. So I do, try to be aware of what products does what to the body. He takes a multivitamin to give him more, energy, because he does definitely need more energy because he's not moving as much as he used to. And just trying to keep them active. I think as they age, or as you age, now that I'm in that senior category, I just like, just move for 30 minutes. I got him a couple of little exercise and things to do. And, because he keeps saying he's getting weak. And I'm like, you're getting weak because you're not moving. You just sitting, just letting life happen. And, and I'm hoping that once the weather warm up, we can get outside. He can sit outside, go up and walk, walking down the street, to give him more exercise, because, that will help strengthening his body.
That's another conversation too, the hazards of immobility.
So every time I say something, that's another topic.
People that are immobile, it opens up a whole can of worms based on respiratory, based on your bowels, all of those things operate much better if you're mobile.
Wow. And that's why a lot of people are they're bedridden, they get the bed sores and
Your
things of that
skin
nature.
breaks down, respiratory breaks down, the motility in your abdomen causes your bowels to slow. Mentally, yeah, that's a whole nother conversation too.
Oh, wow. Well, I think we're going to end it here. I really do appreciate all the knowledge that you have given us today. I know that we're going to come back with another segment, everybody, but this is definitely just giving you a little insight on taking care, being a caregiver, how a caregiver should take care of themselves. We touch bases on a little bit of special needs, that how I have had a son with 33 years that is special needs, and I've been his caregiver, and just taking time for yourself. One thing I want all the caregivers to understand and do, at least try to do something for yourself every day, once a week. Take time to care for yourself, because if your cup is not full, you can't care for anyone else. So make sure that you put yourself first. And one thing, it's not selfish. I used to be that person to think that if I took time out for me with my son, that I was being selfish, but it's not. So you have any closing words, Jewel?
I would just like to say thank you for bringing up this topic. I think it's very much needed in the community. I think that caregivers is worth taking a look at to see how can we improve the quality of life for caregivers, and to also assist them. You mentioned that you belong to a Facebook group, but there are many groups, support groups out there for different caregivers based on who you're caring for or what kind of support you need. And I would also like to say, don't not think about therapy for yourself. You know, go out there and get a therapist if you need to, if you need somebody to talk to mentally to keep yourself sharp.
Yes, and that's something we touched upon too, because that's taboo in our community. And so don't feel ashamed. Don't feel ashamed, because that's real. Your mental health is just as important as your physical health.
That's true.
So, so if you need help, go get it. And even if you don't think you need it, you need it.
Yeah.
I'm just being real, because you know so many people think, oh, that's not me. But really and truly, we all have something that has traumatic that happened in our life, at least in our head, that we believe something happened to us and that, you know, we haven't dealt with. It's so many things we haven't dealt with, from our childhood to our adulthood. We've gotten heartbroken. We've gotten, you know, it's just so many things that people have in their head.
Yes.
And our worst enemies is self-criticism. So I know firsthand, because I was that way. And I'm so glad that I got help, because now I feel so much better about who I am and my life purpose. And I found myself. So yeah, this life is definitely a journey.
It definitely is. And you have to love yourself.
Love yourself first, exactly. Again, Jewel, I want to thank you for coming on, and we're going to try to do another program, guys, that is going to be maybe holistic against pharmaceutical, and then we probably will come back with maybe talking about maybe special needs or something of that sort, because you know the topics that I'm covering are the ones that are dear to me now that I'm a caregiver, and I've been doing, I want to help some other people that's being challenged, taking care of their family.
I would like to invite whoever is watching this, if you have topics that you think we should discuss or that you think is interesting to you or in your realm, you know, put it in the chat, put it in the chat box and let us know. And if we could shed some light on it, I don't have a problem doing that. And if I can't, I can bring an expert that can.
All right now. So guys, we're gonna be doing this on a break. Well, I'm not gonna say a regular, but we're gonna try to do a couple more depending on the response that we get from this episode. So just stay tuned for what's coming. So thank you, Jewel, again for being a part of this. And I just want to thank the audience for just following me for the last year or two as this journey for Denice Total Wellness just is unfolding. So thank you guys, and I will see you later.
Thank you.